everyone. The Southern Healthcare Center teams have made consistent progress with vaccinations among our residents and employees, but with the Delta variant still here and the Omicron variant headed our way, we must act to boost our immunity and minimize exposure for our residents, communities, families, and ourselves. The current data related to the Omicron variant is very important for you to know and act on. This new variant is only 4 or 5 weeks old and first surfaced in South Africa. It was observed to be spreading rapidly and cases doubled every 2 to 3 days. If we experience the same conditions in the United States, it could dramatically impact operations of our profession. At this time, the best preparation is vaccinations and boosters. Let's take a look at the number of new daily cases in South Africa. You'll note that a couple of weeks ago, there were less than 1,000 cases of COVID reported daily. Just days later, there were 40,000 new cases. This isn't isolated to South Africa. If we look at the United Kingdom, which had its first cases of the Omicron variant 2 weeks ago, we will note dramatic increases in new cases there as well. Unfortunately, this rapid increase in positive COVID cases, even with less severe symptoms, can create significant concerns. If you look at the current chart of new cases in the United States, you'll see an uptick in the Delta variant over the past several weeks, but we are still below the highest level of reported cases last December and January, mostly due to increased vaccination and booster shots. If the United States experiences the same phenomenon that South Africa and the United Kingdom have related to Omicron, we will exceed the record highs of last December and January, expecting several 100,000 new cases of COVID every day. We'll also see more hospitalizations and deaths. Fortunately, there is something we may and must do to minimize the risks of contracting and spreading this new variant. For those that are unvaccinated, get vaccinated. And for those that are vaccinated, take the COVID-19 booster immediately. The most current scientific evidence indicates the normal vaccination regimen of the 2-dose Pfizer, Moderna, or 1-dose J&J will be more effective if the last dose was received less than 6 months before exposure to Omicron. But if your last dose was longer than 6 months ago and you haven't received your booster, your initial vaccines are not fully effective. Taken now, the booster will help significantly, and current data shows if you've received the booster and are exposed to the Omicron variant, there's a 75% chance or better of not testing positive, with a much higher chance of not getting sick or being hospitalized. The obvious answer is we must double our efforts with booster vaccines immediately. Nationwide, only 50% of nursing home residents and about 20% of frontline caregivers have received their booster vaccinations. We must focus on increasing our booster shots today. This is the only way we can get ahead of the approaching Omicron virus. While no one knows exactly what will happen in the days and weeks ahead, typically when we see the effects of a new variant in other countries, this is a precursor to what we can expect if we don't act now. This is not a time for panic. This is a time for action and appropriate planning. Please work with your center frontline staff, residents, and their family members, and give booster vaccines as quickly as possible. Thank you very much for all you're doing. Your work continues to be nothing short of heroic. We will do everything possible here at the Southern Healthcare Management Corporate Office to support your efforts.